untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question: what is the most effective way of treating and curing silent GERD silent acid reflux? The terms silent reflux and laryngeal reflux, LPR, were both coined by Jamie Kaufman for what is extraesophageal reflux. In Gastro-Oesophageal Reflux Disorder, GORD or Gerd for US spellers, matter from the stomach backflows into the esophagus through the lower esophageal sphincter. If it is carrying acid and bile, it can cause permanent damage to the esophagus, Barrett's esophagus, that can lead to adenocarcinoma, cancer. Acid suppressant medication, such as PPIs, e.g. omeprazole, and H2 blockers, e.g. ranitidine, reduce the acid, thus making the reflux less damaging. If refluxed matter continues to the top of the esophagus, it can breach the upper esophageal sphincter and be aspirated into the respiratory system, where it can cause further damage including pneumonia and bronchiectasis. To prevent extraesophageal reflux, we must prevent the reflux via the lower sphincter, whether it's acidic or not. It is hypothesized that some of that reflux may be triggered by acid irritation, but fewer than 40% of patients find suppressing the acid actually reduces reflux. It is then known as non-erosive reflux disorder, NERD. Although Jamie Kaufman may be a great otolaryngologist, she is not a gastroenterologist. Her book, Dropping Acid, may have some good tips for avoiding some foods that are common triggers for acid reflux, and she should be applauded for all of the good work she is doing to raise awareness of the issues. However, the book is based upon the false assumption that the acidity of food can change the acidity of the stomach. In reality, the stomach is a reservoir of highly concentrated hydrochloric acid into which some small amounts of mildly acidic or mildly alkaline foods may be dropped. This has as much effect as pouring a kettle of hot water into the ocean. The reality is, we're all different and affected by foods differently. It is more important to know your own trigger foods, which may be discovered by keeping a food diary. To reduce reflux, lifestyle choices need to be made. Lose weight if necessary. Avoid tight clothing. Avoid bending or exercises that compress or shake the stomach about after food. Leave at least 3 hours between the last meal and going to bed. Raise the head of the bed by 6 to 8 inches. Sleep on your left side. If lifestyle changes are ineffective, you may need to consider anti-reflux surgery or lower esophageal augmentation. There are many ways of attempting this, but the gold standard tried and tested method is fundoplication. Nissen fundoplication was first carried out in 1955. Since 1995 it has been performed laparoscopically, with long-term statistics proving efficacy in over 90% of patients. Out of the newer techniques available, links, a bracelet of magnetic beads threaded around the lower esophagus, looks the most promising, but long-term data for more than 5 years are not available, and from short-term data efficacy is around 85%. But this is better than less invasive procedures such as endoluminal gastriplication, e.g. transoral incisionless fundoplication, TIF, and the Stretta procedure, which both have short-term data giving efficacy of around 65%.